we continue to monitor the COVID-19 outbreak in China and the rest of Asia. India may have just reported 3 confirmed cases as of now, but the country is putting 16,000 people under surveillance in a move to prevent an outbreak. And the steps taken include stricter screening at 21 airports across the country. In fact, to take that story forward, we are joined by the Honorable Health Minister of India, Dr. Vardhan, who joins us live from New Delhi. Rob Subramanian continues to be our guest host this hour. Dr. Vardhan, thank you very much, sir, for joining us this morning. Could you highlight, for the benefit of our viewers, the precautionary measures that the Health Ministry in India is taking at this critical time?
You see, we started taking action on this in the middle of January, at least 2 weeks before the World Health Organization declared it as an emergency of international concern. From the day one, we started with all full-blown measures, which included screening of every passenger coming from China, and it started from 7 airports, and then within a few days we started doing it on 21 airports. We created facilities for lab. Started from 1 lab, we created facilities in 15 labs, which now we have the potential of even taking up to 50 labs in the country if there is a need. For every patient who was coming from China, and then of course later on from Thailand and Singapore also, we started the screening, and it was a thermal screening, detailed history, and of course we issued also advisories to all those who are traveling to China or coming back from China. We improved upon our advisories by ensuring that all visas, e-visas are cancelled for all the passengers, foreign passengers coming to India. And then we have put almost 15,000 people on surveillance in all parts of the country. And we have ensured till now 2.5 lakh passengers coming from China, Thailand, Singapore, and now we have added to that list Japan and Korea also. They have been screened, and every patient is being watched, every passenger is being watched. We have done the thermal screening. We have taken detailed history in the aeroplane itself, and whatever is technically possible, we have done that, and I'm sure that we will be able to ensure that coronavirus doesn't enter India in any epidemic proportion in the near future also.
Okay. To that number, Dr. Vardhan, while there are only 3 confirmed cases, I'm just intrigued to understand why 16,000 people have been brought under surveillance. Is your intelligence telling you that there is fear of an outbreak that you want to contain ahead of time?
You see, I will tell you, I will explain to you. For every passenger coming to India through these flights, which is, I think we have screened by now over 2,000 flights, we do a thermal screening, we take a detailed history, and even if there is a remote suspicion of anything positive in the history in any form, any sore throat, any cold or anything, then we ensure that that passenger, even if he doesn't come out positive in the thermal screening, we keep a watch on it, and we have a very strong integrated disease surveillance system in the whole country, and we pass on the information about that passenger to our state and district surveillance officers. We have got a very good coordination with all our state governments. The whole issue is being monitored at the highest level in the country, and also with the state governments, we are every day on a daily basis we are coordinating. So they have been kept under watch as a matter of abundant precaution and abundance, you can say, we are ensuring that at least that 2 weeks incubation period, we take absolute precautions, even for those who are coming from outside and don't produce any symptoms or any history. We are advising them home surveillance for about 4 weeks. So it's a matter of precautions only. And for those where there are symptoms, we are taking them up to isolation wards in our hospitals.
Right, sir. Dr. Harshvardhan, there was also reports suggesting that there are few Indians who are stuck on those cruise liners near the port in Japan. And the expectation was that India would be planning to rescue them in some shape or form. Because a lot of those Indians are reaching out directly to the health ministry, to the government, saying that they don't want to be abandoned on the ship and that they want to go back home. What is being done in that regard?
You see, let me tell you that we are constantly in touch with our embassies in Japan. We are constantly in touch with the Japanese government, and as per the scientific protocol, the Japan government wants all the passengers to be quarantined on the ship. And I think their quarantine time is finishing on 19th. So we are in touch with the government. Our embassy is in touch with those passengers on that ship. And as soon as the quarantine period is over, we will make adequate arrangements along with the, you can say, consent and involvement of the Japanese government to bring them back to the country.
And sir, I'm interested in your experience as a doctor. I mean, many have pointed to just how contagious or infectious this virus is. But when it comes to the death toll we are watching mostly out of mainland China, what can you tell us about what happens when someone succumbs to this virus? Is it only those who are ill, who have previous illnesses and who are older? I mean, that is mostly what we've seen. But what are you watching in that regard?
I'm sorry, I couldn't follow your question. Could you please repeat it?
Sure. In terms of just how severe this virus is, in terms of what we expect for those not just confirmed cases, but the fatality, how serious is that risk of fatality?
You see, we are taking all possible precautions. As far as this particular virus is concerned, we know that although the mortality rate is quite low, that's about 2%, but the infectivity rate is quite high. So you have to take extreme precautions. That's why we have ensured that there is screening at the airports, there is screening at all the major and minor seaports also, and all our borders with Nepal, our neighboring country, where we also had a positive case. We are screening all those borders and all the departments of the government of India, whether it is the Defense Ministry, whether it is the Home Ministry, whether it is the Foreign Ministry, whether it is the Shipping Ministry, whether it is the Ministry of Pharmaceuticals, etc., etc. Every concerned ministry is actively involved in ensuring that we plug every possible loophole which can allow the entry of the virus in a big way in the country. And we are sure that we could handle Ebola in 2014, we could handle other diseases, and we can handle this coronavirus also quite well.
Okay, and sir, just one last question on the upcoming visit from President Trump and a large delegation from the United States. We're expecting huge crowds to come out and see President Trump on this visit to India. Are there any special precautions taking place given the large gathering of crowds?
I think anybody can safely travel to India, and irrespective of who the person is. And we are happy that such a big dignitary is coming to India, and we can assure everyone in the United States or any other country that they should not have any hesitation in coming to India. We have taken abundant precautions to ensure that coronavirus is not spreading in India. in any epidemic proportion, or otherwise also in a huge country with 1.35 billion population, and where we have screened 2.5 lakh passengers, you can jolly well understand that we could get only 3 positive cases. Out of these 3 positive cases, one has already turned out to be negative, and the patient has been discharged, and the other 2 shall also be soon discharged in a few days.